My name is Olusunbo, and I will be talking about a gastrointestinal disease. I'll be talking about irritable bowel syndrome. The pathophysiology of irritable bowel syndrome is it occurs due to repeated pain in your abdomen, and sometimes there may be changes in your bowel movements. And some of the signs of irritable bowel syndrome are diarrhea, constipation, or the patient can have both diarrhea and constipation. Um, you have symptoms that can be visible signs of damage of the disease in your digestive tract. And some of the most common symptoms of IBS are pain in your abdomen. Sometimes the pain is related to your bowel movement and changes in the frequency of your bowel movement. Some of the changes may be due to diarrhea or constipation, cramp in the stomach, and these symptoms can be triggered by food. Sometimes when you eat food that are spicy, you can have a symptom of IBS. The diagnosis testing for IBS are medical, and the nurse can ask for the family history when conducting a physical examination. Then we can do the blood test to rule out any form of gastrointestinal disease. The clinical manifestations of the disease are pain in the abdomen, sometimes irritation, which can cause redness and edema in the perineal area. Sometimes the patient can experience nausea, vomiting, dyspepsia, which is indigestion due to the food content. And extreme dieting can also be a clinical manifestation of the disease. Patients who are obese or have genetic factors can also experience IBS. The interprofessional care, the nurse is going to work with the doctor, the dietitian, to develop a diet plan for the patient. And the patient can be given fluid to increase the fluid intake and prevent dehydration. It is essential for the nurse to offer clear liquids early, and he or she should avoid cold foods and provide an opportunity for the patient to talk about the disease. The nurse can observe for fever, tachycardia, lethargy, leukocytosis, decreased serum protein, anxiety, and prostration. The nurse should provide and educate on bed rest, and should provide the best cycle mode if the patient needs to go urgently. And she should also observe for abdominal pain, cramping, blood in the stools, emotional upsets, and physical exertion, because going to the bathroom frequently can make the patient lethargic. And the nurse should observe and record stool frequencies, characteristics of the stool, the amount of the stool, and other precipitating factors. The treatment plan for IBS can change due to each patient's signs and symptoms and what the patient just had. Sometimes lifestyle changes can help with IBS, and the nurse should recommend diets that decrease or triggers IBS. Some medications that can be used are probiotics. This can be found in yogurt, and mental health therapies. Sometimes the patient can be advised to do non-pharmacological therapies like deep breathing, relaxation, guided imagery. And the patient can be educated to eat more fiber, avoid gluten food, and follow a diet that is low in sodium and a diet that is low in sodium. So I'm going to use the nursing process, the assessment, diagnosis, planning, implementation, evaluation to talk about IBS. When assessing the patient, the nurse should conduct physical examination and ask about the nutrition of the patient, the family history of IBS, the environmental factors that triggers IBS, if the patient has recently gained or lost weight. The nurse should assess for current and past medications, and especially if the patient is on laxatives or enemas due to constipation caused by IBS. The nurse should assess for the dose of the medication, the frequency, and the length and side effects. And sometimes some of these medications can have hepatotoxicity, so the nurse should check for any medication that can trigger toxicity, which will affect the liver. Sometimes the nurse needs to check medical surgeries, past medical surgeries of the rectum or abdomen. And smoking is also a trigger for IBS, so the nurse should assess for smoking and alcohol use. Patient education. People suffering from IBS may not have enough information about the disease. The nurse should educate the patient about food that triggers constipation or diarrhea. The nurse should educate about increasing the fluid content. The patient has to drink more fluids. Increase activity level, because sometimes when the patient is sedentary, this can affect bowel movement. So it is important for the nurse to educate about increased activity. Educate the patient about dental care also, because sometimes dental cavities can cause IBS. So it is important for the nurse to check how often the patient goes to the dentist and if there is a need for follow-up. It is also important for the nurse to educate about food allergies that cause GI problems. If food allergies cause skin breakdown, the patient might experience IBS. And going to the bathroom frequently can cause redness and edema in the perineal area. So the nurse should educate the patient about how to clean from front to back, and the nurse should also educate the patient to report any pain during defecation or any bloody stool. IBS can be a very irritating disease which can affect the emotional state of the patient. It is important for the nurse to assess for the emotional needs of the patient and maybe educate the patient to join a support group that will help to reduce the stress caused by IBS. Thank you.